Well, welcome everyone. This is our fourth annual Community Engaged Research Institute hosted by the Great Plains IDeA CTR. We are so excited to see all of you today. We're going to have a lot of fun activities. Some panelists talk about their research and then allow all of you to brainstorm some ideas you might have and work towards a funding opportunity that you are all eligible to apply for. So we're super excited for today. We'll do a brief introduction and welcome. We have a little icebreaker activity, and then we'll get started with the talks. So my name is Emily Frankel. I co-direct the Community Engagement and Outreach Core for the Great Plains IDeA CTR. And I'll introduce the rest of our team as we move through this little welcome. But thank you everyone for being here today. It's so great to see people in person, and we're just really excited for today's event. So just a brief overview for our little welcome. I'm going to talk about the Great Plains IDeA CTR, what that mechanism is, and some of the opportunities that are available to all of you if you become a member. We're going to go through today's agenda, just briefly talk through some of the talks and individuals you'll be hearing from today. We're going to talk through the folder that you received when you walked in. There are some really important pieces of information in there, so we'll walk through what each of those handouts were. And if you have any questions before we get started, this is a very informal event. We want it to be very participatory and hear from all of you. I will mention for those of you online, we did send out an email this morning that had some of the handouts that were in the folder. And then after today's event, we will send a follow-up with any of the speaker PowerPoints, and we will archive all of the video recordings as well and make those available to all of you. All right, so I don't know how to make this go away. Nope, wrong button. Okay. There we go. All right, so like I mentioned, we are the Great Plains IDeA CTR. This is a funding mechanism to support clinical and translational research. It is an initiative out of the National Institutes of Health. And so for those of you who are familiar with the National Institutes of Health, there are a number of institutes that support different types of research endeavors. The one that we are focused on is the National Institute of General Medical Sciences. They are who fund the IDeA CTR, which stands for Clinical and Translational Research. In order to be eligible for this funding mechanism, you have to be what's considered an IDeA state. So IDeA states typically receive less funding from the NIH than other states. So these are states like Rhode Island, Nebraska, the Dakotas, Montana. So it's about half the states that are eligible for these IDeA awards. And there's three different mechanisms within the IDeA funding mechanism. So COBRES, which are Centers of Biomedical Research Excellence, INBREs, which are our undergraduate institutes of biomedical research, and then clinical and translational research networks, which is what we are. And this is a collaboration of 8 partner institutions, many of which you all are a part of. So it's the 4 University of Nebraska campuses, UNMC, UNO, UNL, and UNK. And then we also have partner sites with Creighton, Boys Town, Children's Nebraska, and the VA. So it's a really collaborative grant to try and improve the health of the state through research. And we couldn't do this work without all of you and the research you all are doing at your institutions. So like I mentioned, the CTR is a collaborative effort between those 8 partner sites. Providing training, education, mentorship, just a number of resources to increase the different research programs and projects that are happening in our state to move the needle and improve the overall health and well-being of Nebraskans. We do also collaborate with individuals from other states. We have very close collaborations with the Dakotas, Iowa, Kansas, kind of the surrounding states, as well as other CTRs across the country. And so the work we do can be kind of sequestered into these little hexagons up here that are all of our different areas of focus. And so we have a pilot program where you are eligible for pilot awards. They're typically like $50,000 to $100,000 in pilot funding. We have our biomedical informatics core. They help us to access electronic health data, biobanking, different elements of biomedical research that is important to pursue your research. We have our biostatistics, epidemiology, and research design core. They can help to set up your research study, maybe pull in some epidemiological data, which we'll hear from later today about some publicly available data sources that can help you with the epi portion of your research. They can help with the biostatistics, so doing some of the analysis of your study. Then we have our community engagement and outreach core, which is who we are. We are charged with training the community as well as academics to pursue community engaged research and to partner with community to enhance research and increase the impact of research. We have a tracking and evaluation core, which focuses on tracking our projects and making sure that we are meeting our metrics and milestones. And we'll hear from the director of our tracking and evaluation core later today to talk about the importance of evaluating community engaged work and some innovative ways to do so. We have our professional development core. They put on a number of trainings, seminars, all sorts of different events to increase professional development. And then all of this is managed by our administrative core. And so it's kind of a hub and spoke model where the admin core is the hub and they ensure that all of the programs and cores are working copaesthetically. But if you have any questions about any of these programs or the different cores, we are happy to provide more information. So as I mentioned, we do a lot of pilot funding and individual smaller research projects, and they are all guided by our health priorities list. So these are the health priorities that have bubbled to the surface as of recently. What we do is we take the community health needs assessments that are conducted by the different health departments across the state, and we present that data to our community advisory board and say, which of these issues are being talked about in your community? Which ones should we focus on? And so this is really a community-driven list that is informed by both the community health needs assessments as well as some publicly available data about the health of our state. And so as we have our networking session later this afternoon, we're going to ask that you kind of consolidate around some of these areas and hopefully are able to discuss some research questions you have or just thoughts on your mind that pertain to these health priorities. And hopefully you walk away with a partner or some collaborators that you can apply for some funding around one of these topic areas. And we are always open to other topic areas as well. These are pretty broad and they do cover most of the needs of our state. So our core leadership, there are 3 of us who really drive the core activities. So Dr. Kiana King, who will be joining us here in a little bit, she is the director of the Community Engagement and Outreach Core. She is an associate professor in the College of Public Health at UNMC. She wears a number of hats in the community as well. So for our community partners in the room, I'm sure you are very familiar with Dr. King. She has been leading community engagement efforts for a while now and is very well known in the community. Myself, I co-direct our Community Engagement and Outreach Core, and I also manage our practice-based research network. This is a collaboration of clinics across the state who have expressed interest in participating in research in some capacity, but maybe don't have the bandwidth or some of the training that you would receive as an academic. And so we provide resources to our community clinics to encourage them to conduct community-driven and practice-driven research. We have a number of opportunities available to our practices to increase their competency and interest in conducting research. We'll hear later this afternoon from an investigator, Dr. Rochelle Hoffman, who has utilized our practice-based research network to conduct a pilot study. So she can talk a little bit about her experience working with the network and what that experience looks like. And then Casey Allen, who's in the back of the room. She is our community engagement, dissemination, and evaluation and outreach specialist. She will be, I think, maybe discussing a little bit later about dissemination and some of the work she does. She's a jack of all trades. She also coordinates our tracking and evaluation core. So she really pulls in her expertise with community engagement and evaluation to make sure that the work we're doing is impactful. So on today's agenda, after we go through some icebreakers just to get you all comfortable today, we are going to have a talk from a community facilitator on building relationships with the community, what that looks like, how you can go about building those relationships and really sustaining meaningful partnerships. We will then have two panels. One of them will be understanding the role of community in research from the community's perspective. We have a few community members who will talk about their experience participating in research and leading research and what that means from the community's perspective. We'll then have a panel on community engaged research projects. So one of the documents that we distributed was a RFA, or a funding application for community engaged research projects. We'll have some of our past awardees present on the type of research that they submitted for those projects, how they were successful, and kind of lessons learned from that funding mechanism. Then we'll break for lunch and do a networking session. What we've done is we've created some table tents where we will kind of coalesce around those health priorities, and you all can talk to individuals who have shared research interests and hopefully come up with some ideas that you could put forth for that funding application. Then we will have an individual from the epidemiology department at UNMC talk about data resources that are publicly available that you can use either as pilot data or to enhance your research applications. And then we will end with evaluation and impact reporting of community engaged research projects. So although this is not comprehensive of community engaged research, we hope that this gives you a little taste of the different elements of community engaged research throughout the day today. And the overarching theme of today's event is centering communities and collaboration. So just really kind of keep that at the forefront of your mind as we work through today's sessions. Okay, so for those of you who are in person, you all received a blue folder upon entering today. In that folder, you had a number of handouts. There is an agenda that goes through all the talks today, what time those are at. There's also the funding announcement for the Community Academic Partnership Grant. I will mention there are two different funding mechanisms within that one RFA. There's the Capacity Development Award. This is a $5,000 award that is geared towards individuals who are interested in forming partnerships. There's no research expectation of part of that $5,000. It's if you have an idea that you're curious about or want to start forging some partnerships, the $5,000 is meant to initiate those partnerships, maybe have some community meetings or listening sessions, different things like that to build those relationships with your community partner. The second opportunity is our pilot. It's a $25,000 community pilot grant. And this is for individuals who probably already have a partnership or are forming a partnership but have a research question in mind and want to see that through. So those are the two different funding opportunities that you'll learn about in that RFA. Applications are due November 20th, and the earliest start date will be July 1st of 2025 for those projects. For those of you who are online, we disseminated an email this morning that has all of these handouts as well. And again, we'll send a follow-up email at the conclusion of today's event that has these activities as well. You also have a pre-evaluation survey in that folder. As you'll learn at the conclusion of today's event, when we talk about evaluation, it's really important that we do these baseline measures just to find out where all of you are at in your community engaged journey and make sure that the work that we are doing providing these training opportunities are making an impact. And so we really encourage you to fill out those pre-evaluation surveys. We'll come around and collect those here shortly. And for those of you online, I will put the link to the survey in the chat. For those of you who joined earlier, the link should already be in the chat, but we'll put that in the chat again as well. And then there are a couple speaker handouts. Two of our panelists for the community academic pilot panel provided handouts, some key takeaways from their project. So you'll find those handouts in that folder as well. And then lastly, there is a membership flyer for the Great Plains IDeA CTR. We encourage you all to become members if you are not already of the CTR. It's free to be a member. There are lots of resources. All of those cores I talked about earlier, whether it's pilot funding, biostatistics support, community engaged consultations, all the different services that we have to offer through the CTR. You will learn about those opportunities. If you become a member, you'll get a weekly newsletter that highlights all of the up and coming events. We also pull information from the NIH and other pertinent sources of information regarding funding opportunities and events that are happening that clinical and translational researchers and community members might be interested in. So it's a really great resource to learn more about different events that are happening. And then for those of you who do want to join quickly, we did put the QR code. You can scan that and become a member. It's a really easy process. You just type in a little bit of information about yourself, your name, what institution or community you're part of, and we will get you added to our listservs. And any questions that you have, we are happy to facilitate those as well. So like I said, today is meant to be pretty informal. We want to hear from all of you. If you have any questions, please feel free to ask those throughout the day at any time. And then for further follow-up, the three core members of the community engagement team, our emails are listed here on this slide. You can reach out to us at any time and we're happy to facilitate and answer any questions that you may have. We'll send these slides out, like I said, at the conclusion of today's event, so you'll have access to all of this information as well.